Hi, my name's Kelly Carden and I'm a diabetes specialist nurse from West Hampshire Community Diabetes Service. I'm going to talk to you today about treating hypos. A hypo is when your blood glucose levels are below 4 millimoles and you need to treat this with approximately 15 to 20 grams of rapid acting carbohydrate. This could be 4 to 5 jelly babies, 6 fruit pastels, 200 ml of orange juice and not squash, 4 to 6 glucose tablets, or 2 tubes of GlucaGel, 170 ml or 200 ml of a Lucozade type drink, or a glucose juice. You will then need to check your blood sugar levels about 10 to 15 minutes afterwards, and if your levels are still below 4, you will need to repeat the treatment that you've already done. Then once your blood glucose levels are above 4, you follow up with a longer acting carbohydrate, around about 20 grams, and this could be a couple of digestive biscuits, a slice of toast, or a banana. I'm going to show you how to give a GlucaGen injection. In a GlucaGen Hypo kit, there's glucagon, which is identical to a natural hormone produced in the body. It works by causing a release of glucose stored in the liver to quickly raise blood glucose levels in about 10 to 15 minutes, and it comes in a single dose. Why would this injection be given? This injection is used in emergency situations when someone has a severe hypo. They may be unable to eat or drink, or may be unconscious. If they are unconscious, please dial 999. It's really important that you stay calm. This is what the Hypo GlucaGen kit looks like. You need to check the expiry date. To open, you will need to twist or run your thumb along the seal to open it. Inside there is a vial which contains powder, and there is a syringe which contains sterile water. You will see a leaflet and a step-by-step picture guide. You need to take the vial out and flick off the cap. Take the syringe out from the box and remove the cap. You then place the needle into the vial through the bung. Push the plunger so the water mixes with the powder. Holding the vial and syringe, turn it over. Draw back the liquid, which is the glucagon, from the vial. As you can see, this needle is larger than an insulin needle, and this is because it needs to go into a muscle. This could be in the buttocks or the leg. You then insert the needle at a 90-degree angle and press the plunger all the way down. You will then withdraw the needle and place this into the sharps container. It takes around 10 to 15 minutes for the person to recover. Once the person has recovered and they're able to eat or drink, they will need to have some fast-acting glucose and then followed up with a longer acting carbohydrate meal.